Welcome to the Nurse Muse channel on YouTube. This is Dr. Catherine Prado-Lefkowitz. Today we're going to be talking about dobutamine. And before we get started, please subscribe to www.nursemuse.com. It's a fabulous website tool that will help you write care plans, and it has a ton of other great resources on there for nursing students. So let's talk about dobutamine, or Dobutrex. This is a medication that you will see in emergency medicine. And the NCLEX and school examinations love to ask you about dobutamine. So let's see what it is used for. So dobutamine and shock. So dopamine and dobutamine, do not get these two confused. A lot of people do. So I'm going to give you a trick to remember dobutamine here in a little bit. But dobutamine is used in the treatment of shock, and we're going to talk about how the medication works. So dobutamine stimulates beta 2 adrenergic receptors as well as beta 1 adrenergic receptors in the heart. So remember our last lecture on beta blockers. So we have beta blocker receptors 1 and beta blocker receptors 2. So remember, we have one heart and two lungs. So when we talk about beta 1, we're referring to the heart. And when we're talking about beta 2, we're talking about the lungs. So we need to really understand beta 1 and beta 2 when we're talking about dopamine. So septic shock. So when somebody goes into septic shock, what is happening? They have a huge drop in blood pressure, and this can lead to respiratory or cardiac failure, stroke, dysfunction of the organs, and possibly death. So septic shock is a severe complication of sepsis, and one telltale sign is a very low blood pressure, an altered mental state, and organ dysfunction. Septic shock has a mortality rate of 30 to 50%, making it very dangerous if we don't treat this ASAP. So one of the hallmark signs is that very low blood pressure all of a sudden. So if you're working with a patient and you start seeing some signs and symptoms that are listed here, we need to start doing further assessment and possibly alert providers to get more people in the room. So we're working with a patient and he all of a sudden has low blood pressure. Of course, you're going to start your head to toe assessment, and you're going to notice that he has pale and cool arms and legs. He might be complaining of being cold or having chills. Then we start seeing some cyanosis going on. So bluish discoloration of his fingers or toes or lips. He might have problems breathing. You might notice leading up to this, he had a decreased urine output. He might complain of dizziness and might be a little confused. Cardiogenic shock. So this is a state of inadequate cardiac output, even though we have adequate intravascular volume, resulting in hypoxia. So again, if you see your patient and he starts having cold, mottled skin, he has a really high heart rate, but his blood pressure is low. Remember, when our blood pressure goes low, our body tries to compensate by increasing that heart rate to get more blood to the periphery. Again, altered mental status and narrowed pulse pressure. So what is cardiogenic shock? The pathophysiology is it can happen after like an MI or ischemia and loss of the left ventricular function. So when we're talking about shock, we're talking about those ventricles are not pumping enough blood to meet the demands of the body. So rich oxygenated blood is not getting to the extremities. So we have a decrease in cardiac output. Our stroke volume is decreased. Of course, our body's going to try and compensate. So we're going to have tachycardia. We're going to have a high heart rate and a low blood pressure. And of course, if the patient's already had ischemia, now we're getting less blood to the organs of the body. So we might have worsening ischemia. So again, cardiogenic shock signs and symptoms: rapid breathing, severe shortness of breath, that tachycardia, loss of consciousness, a weak pulse, low blood pressure, sweating, pale skin, again, the cold hands or feet, and not having enough urine. Remember, our goal is 30 cc's per hour. So either when we're talking about cardiogenic shock or septic shock, our ventricles are not pumping enough blood to meet the demands of the body. So we somehow need to get those ventricles pumping to increase blood pressure. So medications we use for shock, what we're going to talk about here is dobutamine. So it's an inotropic medication, an inotropic drug, and our goal is to improve that heart function. So the first thing we're going to learn about is dobutamine. So what is dobutamine? It can also be called Dobutrex, and it's a positive inotropic agent. And we use this for heart failure, cardiogenic, and septic shock. It is primarily a beta 1 agonist. So remember our beta 1s and beta 2s. Beta 1s are in the heart, so it's an agonist. So we're going to increase the beta 1 in the heart, which is going to increase the contractility of the ventricles and increase the stroke volume. Remember, there is a mathematical equation where we can figure out cardiac output. It's heart rate times stroke volume. But anyway, we're focusing on beta 1. It's a beta 1 agonist. We're going to turn it on in the heart, get our heart pumping more effectively and efficiently. So, dobutamine, a cardiac inotrope. The heart responds to dobutamine in the same way it would respond to exercise. Remember, we're hitting that heart hard. We're increasing it. We're going to stimulate the beta 1 receptor, and it does affect beta 2 receptors and alpha receptors that have a vasodilating effect, but not so significantly that we would not use this medication. So when do we use dobutamine? Well, it's approved by the FDA, short-term use in patients with decreased contractility due to heart failure or cardiac surgical procedures that lead to cardiac decompensation. So our heart is not pumping effectively, and our heart rate is increasing, but our blood pressure is plummeting. So what does dobutamine do? It's going to increase our cardiac output. It's going to cause the heart to squeeze more effectively, more efficiently. We're hitting those beta 1 receptors in the heart. And because people get dobutamine and dopamine mixed up. Remember, dobutamine has a B in it, so we're talking about beta. It's a beta agonist. And of course, if we're giving dobutamine, this would be in a medical emergency situation. You as a nurse would want to be monitoring the cardiac output because that's what we're trying to increase. And also monitoring those peripheral pulses because at first they are weak and thready. We should get stronger pulses coming out of our use with dobutamine. So when do we use this medication? Of course, dobutamine is a medication used in the treatment of cardiogenic and septic shock and severe heart failure. We can also use dobutamine in some cardiac stress tests, but we have to be careful with the patients that we give dobutamine to. And of course, we're going to give the amount of medication needed to have the desired effect. So what do we as nurses need to watch? So we need to watch for hypotension because, like I said, we are going to have some beta 2 receptor stimulation as well as some alpha receptor stimulation, which does vasodilate. Our patient already has too much hypotension. So if for some reason the body is not responding to the dobutamine and our blood pressure is going lower, this is something that we need to communicate ASAP. Dobutamine can lead to some PVCs in the heart. And just understand that if the patient is already taking a beta blocker, when you give dobutamine to the patients on a beta blocker, the beta blocker might negate the effect of dobutamine because remember, the beta blockers are blocking those beta 1 and beta 2 receptors, and now we're giving a medication that's stimulating them. So just understand if the dobutamine is not working, it might be because the patient's on a beta blocker and the beta blocker is interfering with the dobutamine. And dobutamine has been known to cause hypersensitive reactions to the skin, so you as a nurse want to be assessing for that as well. So when do we not give this medication? So there are 5 diseases that we do not use dobutamine with, and one is asthmatics. The second one is those with arrhythmias. The third is those with hypotension, and this is like when we're giving the dobutamine in a stress test. If the patient already has hypotension, we're not going to give this. IHSS and hypokalemia. So asthma. This giving dobutamine, it's a potential hazard, a moderate plausibility. So dobutamine injections contain sodium metabisulfate, and this sulfate may cause an anaphylactic symptoms or life-threatening symptoms to asthmatic patients. So again, if we're going to choose any medication for like that outpatient stress test, we're not going to give this to asthmatic patients. Arrhythmias. We do not like to give dobutamine to patients with arrhythmias. Dobutamine stimulates the beta receptors of the heart, and these agents have been associated with increase in heart rate, which is what we want to try to reduce, right? We're trying to increase our blood pressure and decrease our heart rate. Atrial fibrillation, hypertension, enhanced AV conduction, and arrhythmias. So we're going to be very cautious when we give people dobutamine with arrhythmias. We try not to give dobutamine with patients with arrhythmias. Hypotension. So the use of dobutamine has infrequently been associated with hypotension, especially in dehydrated patients. Remember that we are going to stimulate the beta 2 a little bit, and beta 2 receptors do cause vasodilation. So our goal is, our patients are too hypotensive right now. We're trying to increase our blood pressure, not decrease it. So we need to really monitor ECG readings on these patients and make sure that our patients aren't getting worse in terms of their blood pressure going down. IHHS, so idiopathic hypertrophic subaortic stenosis. We're not going to give dobutamine with these patients because they increase the pressure gradient within the left ventricle and worsen cardiac output in patients with these diseases. And then hypokalemia, so patients whose potassium is too low. We know that dobutamine has been associated with hypokalemia, so if your patient already has hypokalemia, this is not a medication we want to give because it might wipe out their potassium even more. So we need to be very cautious, and of course we're going to be monitoring their serum potassium along with all of their electrolytes after we get this patient stable. So here's a question for you. Dobutamine improves cardiac output and is indicated for the use in all of the following except. So we already know that we do not give dobutamine with patients with arrhythmias. It can cause further arrhythmias. And of course, we're going to give it in septic shock and congestive heart failure because we're talking about our ventricles not being strong enough to pump that heart to the body. And we can give it with pulmonary congestion because this is a sign and symptom of heart failure. So I hope this review helped you to learn about dobutamine, and I'm going to see you in the next session. Remember, you can always email me, cprado@aol.com, with any questions, or text me, 702-493-3420. So remember to join Nurse Muse, and I'll see you in the next session.